Hello everyone, thank you for joining us today as we observe HIV Awareness Month. Today we'll be speaking with Naila Hamidou to discuss HIV prevention, treatment, and even the importance of raising awareness to combat the stigma. Like we always do, I'd like to start by welcoming our guest, Naila Hamidou. She is a brilliant medical student. Hello, Naila.
Hello, everyone. Hello, Sarah. First of all, thank you for having me. It's such a great platform to share my knowledge and my ideas and raise awareness. Gonna start with introducing myself. I'm Hamidou Naila. I'm sixth-year medical student. I'm public health activist, and I'm member of the International AIDS Society.
Amazing, Naila. So, first of all, thank you for accepting our invitation. And I think that it is important to bring awareness to this subject coming from a future doctor or a young individual. It would be I think it would be more simple for a young person to hear it coming from you. I think we have to discuss the scientific information, and then we'll move on to everything civil society, awareness, and how we can shed a light on this important matter, especially that we are in the HIV Awareness Month, which is the month of December. So, first of all, Naila, before we start, I'd like to ask you about the significance of this Awareness Month. When you talk about HIV or SIDA, as it's known in many other regions, it could be sort of a taboo subject to discuss when it comes to public health, but it is important to use this month to shed a light on it.
Exactly. So first of all, I'm gonna start with some history. We have all to know that HIV or SIDA is a recent disease. It's like been discovered recently in the 80s. Okay. In the United States, we reported the first case of a young man who had SIDA or HIV, but the origins, from all the informations we know that it started in the 50s. Okay. in Africa, and with the informations available, we say that it's been transmitted through a monkey to human beings. For the awareness month, actually it's an awareness day. It's on December 1st. It's recent as well. It's been created in the 80s by the World Health Organization. What's the purpose of it? It's like to gather all the stakeholders, all the people working on the HIV field, like doctors, healthcare professionals, association, civil society, all the stakeholders, so we can have like more effective action to raise awareness and to prevent the disease.
Right, so I think you gave the right backstory when it comes to the disease. It's important to understand how it came to be, how recent it is, because when you look into some kind of treatment or maybe diagnosis ways, I think it's important to know that the disease is still fairly new, so there still are a lot of studies to be done, and hopefully a cure will be found, or maybe a way to prevent it or something like that. I think we should also talk about how public awareness and understanding the core meaning of HIV can change over the years. When it was first maybe discovered in the 50s, I think it was a huge scandal, because if you had it, it means you were banished from society, which it still is the thing that happens, unfortunately, today, but it's getting better, I think.
First of all, let me start with a context. So what is HIV or SIDA?
Right.
It's very important to distinguish between the two concepts. HIV, it's a human immunodeficiency virus. VIH, virus d'immunodéficience humain, ولا نقص المناعة المكتسب. It's a disease. It's a contagious disease. It's a chronic disease that attacks the immunitary system of the human being. Like we all know الكرية الدموية البيضاء. I'm gonna be a bit general to simplify the information. This virus attacks the الكرية الدموية البيضاء of our body, and it spreads very quickly in the human body. And it's a bit challenging these days to find a cure for the disease. I'm gonna talk about it later. But the SIDA is something else. The SIDA is actually a stage of the virus, contamination, which is very advanced. You start with having the virus, then it can develop through multiple years. It depends, it can be from 2 years to 10 years. It depends on the immunity of the person. If you don't get the treatment, you can go to SIDA. Donc c'est le syndrome d'immunodéficience humaine.
Right. Is it the stage of the disease where if you get a cold, you risk your life? Is it?
Exactly. So with SIDA, it's very advanced. So you get to start what we call opportunistic infection, opportunistic diseases, which can be like life-threatening. For example, we have many viruses and diseases that we don't usually observe in people, in normal people like us. If you don't get your immunity affected and deeply affected, you don't catch the disease. For example, le cancer de Kaposi, la cryptococcus, la toxoplasmose cérébrale, etc., etc. And the problem is with the opportunistic infections more than the HIV itself.
Okay, so what you're saying here is that if we can follow the right treatment plan, I think we could keep the disease in control and not reach the SIDA stage.
Exactly. Okay. So basically, this is like the main goal of the treatment is to prevent the SIDA stage, and we're gonna talk about it later. What's the treatment and what it does exactly to the body?
Okay, amazing. So I think when it comes to this kind of disease, a lot of misconceptions go on, especially when you don't have the right information, when the awareness is not being spread in the right places. What are some of the most misconceptions that you have heard over the years?
Actually, I think this is the main cause why I am here, just to tackle this problem, which is the taboo behind the SIDA. We hear a lot of misconceptions. For example, I'm gonna give like the main 3 misconceptions. The first one: if I have HIV, I'm gonna die. No, not necessarily. It's such a disease like diabetes or something else, a chronic.
But you can learn to live with.
Exactly. Mm-hmm. So we are fortunate to have the treatment. It's not gonna cure it, but at least it's gonna like. You can work on the symptoms and you can work on the virus. So just you can live normally with it. So you're not gonna die. You just gotta take your treatment. The second one is it's transmitted by mosquitoes. We hear a lot of this misconception. It's not. We're gonna tackle how it's transmitted, and we talk a lot about sexual life. If I have HIV, I'm not be able to have a normal sexual life and to get children, which is not true at all.
You can have children. Yes.
Exactly. You can take your treatment, have a normal sexual life, without transmitting the virus to your partner, and have kids normally. Finally, we say that it's the taboo, why it's here, because people think that people with HIV, living with HIV, are dangerous.
Right.
So no, not necessarily if they are taking the treatment properly, and we have to be informed of how it's transmitted so we can protect ourselves and others.
Okay, so before we talk about maybe the ways to prevent the transmission, can you give us a general idea about how the disease is transmitted? When you talked about the mosquitoes thing, I think it's because HIV is transmitted via blood, so automatically they make the connection that mosquitoes will draw blood from you and then give it to someone else. You know, that's the general idea, which is false, along with a lot of many other things. Could you now give us the real way that HIV is transmitted?
Exactly. Thank you for the question. So in medicine, we have 3 ways. 3 ways of transmission. First of all, sanguine, sexuelle, et materno-fœtale. So through blood, through genital secretions, and from the mother to her
child,
kids,
yes.
while she is pregnant, of course.
Or breastfeeding.
Exactly,
also, yeah.
Breastfeeding. The most important one, the most frequent one is the sexual transmission. So direct sexual intercourse. So the saliva is not included. We have the blood. So for people who use drugs, and every time
needles and
exactly every time you use a needle or everything which is in contact with your blood of someone who is infected with HIV, it can spread the infection. And we have like from when a mother is pregnant with she already has HIV, she is pregnant, she can
the child is born with it.
Yes, she can somehow transmit the infection if she doesn't take the treatment properly, or through let me say while giving birth. This is why we do la césarienne for patients with HIV, césarienne systematic, and through breastfeeding. So breastfeeding is banned for the moms who have HIV. So we have to be careful. It's through sexual intercourse, direct sexual intercourse, no touching. Touching doesn't spread the infections. People who have HIV aren't dangerous to touch. No saliva. No, like other body secretions, like sweat, tears, etc. That doesn't transmit HIV from
so
the
just
mother. Blood, genitals, sexual intercourse, and mucosa, and finally the mom through pregnancy or breastfeeding.
Right. So now we have a general idea on how it's transmitted. How could we stop it or maybe diminish it from being transmitted? If you have HIV, you have been diagnosed, how do you act around other people so you wouldn't give them the disease?
Perfectly. So how I'm gonna tackle the question, I'm gonna start with the people who already know that they have HIV. So it's up to you to protect people. How? It starts with taking your treatment. What does the treatment do? You have a quantity of virus in your blood, so this is what we call la charge virale. So the treatments aims to diminish that quantity of virus in your blood. We can like have an undetectable charge virale, and when it's undetectable, it's not transmittable to other ones. So you can have like normal sexual life, like even your blood is safe if you take your treatment properly. So you start with that, and of course communication with your partner if you have an already active sexual life. For people who don't have HIV, so first of all, we have already tackled how it's transmitted.
Yeah.
So you have to work on that. If you have like an active sexual life, so you have to use protections. Condoms are known to be efficient to prevent HIV and all the sexually transmitted infections. To be careful while using the, like if you go to see your dentist
or maybe tattoo artist,
exactly,
everything that's sharp and will enter your bloodstream, you should be careful
exactly
with it.
So tattoos, hijama, coiffeur, dentist,
right, yeah,
you have to be very careful and to use maybe needles or materials that are clean, sterilized,
or maybe a one-time use thing, so you use it and you throw it.
One-time use thing. For the moms, when you are pregnant, it's systematic. Your gynecologist is going to ask you to do an HIV test, and of course we have an early diagnosis for prevention, or what we call screening. If you suspect that you have HIV or you have been exposed to something that may give you HIV, you can go to any hospital, any laboratory to just do the blood test. It's free, and like you are protected, so the doctor doesn't have the right to give your result to something else, to share your personal information. So it's secret, it's free, and you can have it and just to detect it early.
All right, so it's very convenient. I mean, there's nothing that could stop you from going and doing this test if you suspect anything. It would be saving your life and many other people's lives also. So I think when it comes to being tested, how frequently do you think individuals today are being tested? Especially the youth, are they aware of this? Do they go regularly, maybe once a year?
So here, how I'm gonna tackle the information. We have two ways of doing the early diagnosis or the prevention, the screener. First of all, when it's systematic, so the doctor is going to ask you to do it.
Okay.
If you are pregnant, if you have, I'm gonna just give some example. We have a lot of them. If you are pregnant, if you have another sexually transmitted infection, if you have an immunodeficiency and we don't know the cause yet, it may be that, and a lot of others causes just to do la sérologie VIH. You as a person, when you have to do it, actually when you suspect having the HIV, it's not systematic, it's not like the breast cancer, we have to do it every year or starting from an age-specific age. No, if you have been exposed, as I told you, to
all these factors that could cause it.
Exactly, that can cause it, just go and have your testing. And we have a lot of prevention campaigns, screening campaigns, so it's the opportunity to do it like with no reason, just to know how your status.
Right. So we spoke about the stigma that comes with the disease in the beginning, and you told us that civil society is now working towards making it less of a taboo subject and more of a normal disease that you know we can learn to live with and accept people who have it, and you know keep them included in our daily lives. What do you think civil society in Algeria is doing for this disease?
So I really admire what the civil society is doing. Myself, I've been part of many programs about HIV, and it helps a lot because it can be a safe space for people just to talk about it. And it's such a huge taboo worldwide. It can give a lot of mental health problems, going like through to suicide sometimes, because it's such a huge taboo.
Traumatizing experience.
Exactly. For the people who have HIV, they don't accept the disease. The people around them, they don't accept a disease. Maybe the partner cannot accept the disease. Sometimes when the child have HIV,
they don't accept it
from
child, yeah.
Exactly, from the mom can be somehow guilty.
Guilty, yeah.
Exactly, and as it's chronic, so it has a lot of effects on the personal life, the professional life. So for the civil society, I'm gonna mention the example of Win Alqa. Win Alqa is a national association. I'm part of Win Alqa. Last year we did a huge screening campaign. So it was awareness and screening campaign. We went to universities and many universities where we just talk to the youth, sometimes from young person or young medical student, young doctor, it can be easier just
to receive the answer.
Exactly.
Yeah. I mean, they're more receptive when they see someone their age talking about it.
Exactly. Just to approach the young people. So we did like screening campaign. It was digital through media like you. At the same time, it was on the field, and it was an opportunity to do 700 tests. They were all negative, but alhamdulillah, but like convincing that person just to do the test, to give her or give him information about the disease is actually a win.
I mean, that's an amazing opportunity. I hope to see many other people doing it, especially medical students and those who work in the field and know what it's like to have this disease and how it can really affect your life and stop you from doing a lot of things. We talked about the stigma, but we should also talk about the discrimination that people with HIV might face, especially when it comes to seeking medical help. When you go to a hospital and you're sick, but you do also know that you are carrying the virus. How would this go? I mean, how does it happen?
Actually, it's sometimes very traumatizing for the person just to know that she or he has HIV. But I insist on something. You have to know your rights.
Of course.
So you have to know that the treatment is free. Seeking medical help is free here in Algeria. For example, in Algiers, we have القطار. At every time you suspect or you've been diagnosed with HIV, you go to القطار and you are You have like all the medical staff there just for you to take care of you. The treatment is free and it's secret. No one has the opportunity, the right to reveal.
So your medical records are being kept safe.
Exactly, ce qu'on appelle le secret médical.
Right.
And like the law is with you, so if you are getting discriminated, you can like seek help, déposer plainte or whatever. So it's important to know your right, and the burden is huge. Like while getting informed about the diagnosis, or just while living with the HIV is.
Right. It is hard, and I think we as a society should do our best to make these patients feel included and still feel like they are part of society and maybe keep on living the same life.
Exactly.
That's the least we can do. Okay, so I think we should talk about how close we are to finding a cure, because this is the main question when it comes to this kind of disease. Do we have a cure? Can we have a cure? Will we have a cure? These questions are always being repeated. What do you think?
Actually, HIV is one of the greatest public health problems worldwide.
Mm-hmm.
This is why we have a lot of research going about HIV. So the future perspectives talks a lot about developing a cure. As right now we don't have a cure, we have a treatment that we can take just to control the virus inside of our body and to prevent the complications. It's chronic, it's for life, but scientists are
to
working.
simplify مرض مزمن.
Exactly.
Just like having diabetes
or whatever. So حتاخدوا جحياتك. Which is fine, so it can control the symptoms and you can live a normal life. The perspective of the future talk a lot about finding a cure,
right,
and maybe developing what we have as a cure right now, so we can have treatment with less side effects, treatment we can like take once a month or less.
Make it even more convenient.
Exactly, just to simplify patients' life and the treatment accessibility. And we are aiming to develop a cure, which is very challenging. As I told you, the HIV virus develops and spreads very quickly in the body, so it gave it the opportunity to have maybe some genetic changes. And we talk also about developing a vaccine. So scientists are working on that, and hopefully one day we can achieve that. Inshallah.
Hopefully. So to conclude our conversation for today, I wanted to ask you, as a medical student and as an active member in civil society here in Algeria, what do you think individuals, and especially the youth, can do to contribute to raising awareness for HIV?
Excellent question. So to conclude, I will start with the people who already have the disease. Just know that you're not alone. It's a disease like any other disease. So all what you have to do is take care of yourself, try to have a healthy lifestyle to reinforce your immunity, and to take your disease properly, to ask your medical provider questions, that to educate yourself and to protect the people around you, as I explained before. For the people who don't have HIV, especially the youth, as the
students.
Exactly, the disease especially targets the youth. Educate yourself. Start with that. What's HIV? If you have people with HIV in your area or friends or whatever, try to support them. Actually, it's not easy to face this hardship and this challenge. And finally, we have a lot of civil society actors working on the field, so you just can maybe donate or volunteer with them. It's gonna be such an added value to the society.
That's actually an amazing piece of advice. Thank you, Naila. Thank you for all the information that you have shared with us today, and I hope we brought a bit of awareness and shed a light on this important topic, especially that we just witnessed the Awareness Day, HIV Awareness Day, and I hope this awareness campaign continues on throughout the month. Thank you everyone for watching. Our topic for today was HIV Awareness Month with our guest Naila Hamidou. See you in another episode.